Hello and welcome. We're going to go over how to use the NC HealthConnex Clinical Portal today. You can search for the portal here on Google, Bing, or whatever your chosen search engine is, or you can actually go up here and type in nchealthconnex.gov, and it'll take you to our website. And you see here in the top right section of the website where it says Clinical Portal Login, that's going to take you straight to that login. You need to make sure that the domain is set to HS default. You can see that here, %, capital H, capital S, underscore, capital D, and then lowercase EFAULT. If it's not set to that, you won't be able to log in. I'm going to show you here on our demo environment. Anything of note, you see example here, NC Notify will be undergoing scheduled maintenance on August 28th. From 9 p.m. to 12 a.m. So anything of note will be here in this blue box kind of at the top of the screen. Our static announcements are here to the right. And then the HIPAA and privacy information is here at the bottom. We are on the same side of HIPAA as you all are as providers. So it's very important that when you go into the system, you follow the HIPAA guidelines, which is treatment, payment, or healthcare operations are the only purposes for which you should be accessing patient information. Understand that you are supposed to safeguard that patient information, not share your user ID or password, and report any suspected breach to your supervisor as well as the Health Information Exchange Authority. You need to make sure, as we said, that that is set to HS default, and then you're going to click the login button. It's going to take you here to this disclaimer that lets you know that we do not have 42 CFR Part 2 data, that is substance use disorder treatment data. We also do not have psychotherapy notes, so we do have behavioral health data. That is the encounter information, diagnosis, visit information, but we do not have psychotherapy notes. You'll simply click agree and it'll take you into the system. If you disagree, it takes you back out to the login screen. Now, what you see when you first log in, you can customize. You can click this chevron here to actually bring this out so that you can see all of these. So you can actually set what you want your default application to be when you log on to the portal. I had mine set to patient search. If you're a participant account administrator, you will see this PAA tools. If you are not a participant account administrator, you will probably not see this option. When you get your email once a quarter that it's time to do the quarterly user attestation, you're going to go here to the PAA tools, and you can collapse this menu so that you can see more on the right hand side. And we're asking you to review your list of users, make sure that all their information is correct, that we don't have an excess amount of break the seals for that user. And if that information is correct, you're going to go down here and click attest to audit. When you do, it's going to bring up some information asking you to verify that this information is correct, and then you would simply type your name in here and click attest to audit. You're going to get an attestation confirmation window, and then you're going to simply click OK. If you need to add or remove a user, you can do that here. You can also send an email to the help desk. So you would search for your user here, click search users, and you would go here to disable users. So for example, if someone leaves your organization, you need to remove their access because we don't want folks accessing patient information under your organization if they're no longer with your organization. You would just click disable user, and you can put in here, John Doe has left the organization, please disable their access, and then click the submit request to help desk. Patient search is here. You can also search for patients here up at the top under patient selection and clicking patient search. Sometimes patients report for their follow-up with a form from the hospital, and you may have the MRN and the hospital information. You can search by MRN and hospital. If not, you can search by demographic information. It just needs to be at least last name, first name, and date of birth, because you know that there may be multiple patients with the same name, even sometimes multiple patients with the same name and same date of birth. You will click search. You notice the patient information comes up, but there's nothing that's clickable, because here in this system, anything that's blue is hyperlinked. That means you can click on it, and we have this icon here with the exclamation point that means, oh, we need to declare a patient relationship. That's why we can't see anything. You'll click this declare patient relationship. It's going to ask you, this is your break the seal. Why are you accessing this patient's information? And there's 4 choices. There's I'm a clinician treating this patient. It's for care coordination. I'm conducting a quality audit check, or I'm conducting a privacy administrative audit. And then you will declare the relationship. This is effectively breaking the seal. Now, when you click on this arrow, you will see what information we have. So, labs, radiology, and from which provider. So this is DUHS, Duke University Health Systems. Now it's blue, it's hyperlinked. We can click on it and it will take us to that patient's chart. So again, if this is expanded, it will change how the view is on the right-hand side, but you can collapse that to maximize your view of the chart book. You will notice up here we have the patient's name, sex, age, and date of birth, and the MPI. The MPI, that is a number that is specific to NC HealthConnex, so it will not match your MRN. Any patient alerts are here in this bar, so you can see the patient has alerts, the patient has allergies, patient demographics, and if you click on these, it will take you to that section of the chart. You see this takes you to the allergy section. So in the clinical summary, you now have 2 columns of information that you can review. It's still the 5 most recent. So the 5 most recent medications, 5 most recent allergies, anything that's blue is hyperlinked. You can click on that to get information about, for example, when this allergy was entered into the system and at which facility. This is a read-only system, so you're not going to be documenting anything. You can't mess anything up. It is a view-only system. Each section is searchable. So, for example, if you just want to search for medication and you see there's a separate search bar for historical medications versus current medications, you can simply search and it will bring up that drug. And then if you want to know information on that drug, you can click on the vertical ellipses. It's also known as the kebab menu. And that will let you know extra information about that drug. So for example, instructions, the dose, when it was entered. Same thing, for example, for immunizations. Maybe you need to know when this person had immunizations. You could go in here and search for immunizations. Documents, these are like the hospital discharge paperwork, so you will actually see the visit here on encounters. And that's, in line with the admission, discharge, transfer. So you can see this person had an outpatient visit. You can also see if they have pending appointments under the new appointment section. And then you'll actually be able to see the documents here under documents, that continuity of care document. And if you click on it, you'll actually be able to see that document. For example, if you wanted to see which medications the patient received while they were inpatient, you can click, again, anything blue is hyperlinked. You can click on medications. It will take you to that section of the chart. So you can see if any medications were changed while the patient was in the hospital. Vital signs, you may or may not see any data in this field. It depends on how we get it. Lab results, anything that's abnormal will be in red. And you can click on that individual test result to get more information. Diagnostic studies, this will be where all of your x-rays, MRIs, CTs. And procedures, you may see the procedure code, the CPT code, or you may actually see the name of the procedure. Histories includes medical, social, and family. Cohorts you may or may not see, that's a grouping tab. Demographics are here, so you just need to scroll down. And if you need contact information, you can click on that area to see more information, like next of kin. Insurance information here if we have it on file. And then again, you see that CSRS report, so that you can access it via that individual patient record, or up here on the left-hand menu. If you need to print a document, you will go here to this horizontal ellipses, also known as the meatball menu, and you will click on it. It's going to take you to patient reports. Now, printing is a PDF function, not a function of the viewer, so you will need to make sure this view as is set to PDF. And then you can actually, if you wanted to see pharmacy dispense data, that's here under the pharmacy report. If you want to print off the medications that the patients had, you would go here to patient summary report expanded. And then you can actually search the document for medications. You see, I click on this magnifying glass, search bar comes up here. And it will take you to that area of the document. You see that's page 17. So you can scroll to see where the end of that section is. Click on the print icon. You can print the entire document if you want to, but if you just want to print the pages of interest, you can do that here. And then click the print button. If you need to exit out, you can hit cancel. If you want to download or save the record, you could do that here. You're not able to print an individual document that you're looking at. For example, if we can't print this page here, we would still need to go to that horizontal ellipses and click patient reports to print from here. If you have direct secure messaging through NC HealthConnex, that will appear here. Most people have direct secure messaging through their electronic health record vendor. So if you have eClinicalWorks or Athena or Epic, your inbox is your direct secure message. Inbox, if you do not have it through your EHR vendor, because some smaller practices do not, we offer that free of charge. You would just need to have a full participation agreement with us, and you would need to contact the help desk at hiesupport@sas.com and request to set up DSM. It looks similar to an email because that's what it is. It's a secure encrypted email. If you wanted to send a message to a provider, you would simply click compose, and you can use this to button to actually search for that provider. So let's say that I have a question for the radiologist about this x-ray because I need to know, do I need to send them to pain management or to neurosurgery? Then I could actually, send a message to this provider. While you cannot see images inside the system, you can be sent images as an attachment. So using that same example, say you're the primary care provider, you have a question about the x-ray because you want to know, again, do I send them to pain management and PT, or do I send them, to surgery? You could always message the radiologist and say, hey, so I see the report here in NC HealthConnex, can you send me the image? And they would actually be able to add that image as an attachment and send it to you. If you have NC Notify, it's going to appear here, and you can click here where it says view notifications. So that will take you to your NC Notify dashboard where you can see your notifications on your patients. And we also have the self-service panel loader if you are uploading your own patient panel. Now, this is CSRS, and again, this may or may not show up. It depends on your access and your view. As you saw, it showed up in the patient menu, may also show up here on this top left menu. And then the set default just simply lets you allow what you see when you log in. Up here is the user menu. So if you click on your username, it will give you the option for profile, help, or log out. If you click on profile, your name, first name, last name, and email is populated by the help desk. You will not be able to change that. However, you can enter your information here for your address, phone numbers, if you need to change your password, new challenge questions. And of course, if you have any questions, need any help navigating the portal, the outreach staff is happy to set up training sessions and kind of walk you through and show you how to use it. If you need NC Notify training, hopefully you all find some value from using the NC HealthConnex Clinical Portal.